video is on bicalutamide. It's like the general information on it and my experience taking it as a trans woman and using the papers that came with it, the prescription, because that has the basic information on there. Like with my other videos. Okay. Its pronunciation is Bicalutamide, and the brand name US is Cosadex. Well, if you, at the beginning of the video, all that information, pretty much the brand name in Canada, like all of that, if you can see. So, what is this drug used for? It is used to prevent prostate cancer. It may be given to other reasons. Yeah, it may be given to you for other reasons, like talk with your doctor. It's pretty much bicalutamide. It's not a testosterone blocker, but binder, meaning it binds around the testosterone. Then that prevents it from absorbing into the system, and your body doesn't stop producing testosterone. It just keep producing it normal. It's just it doesn't get absorbed because it binds around the testosterone. What do I need to tell my doctor before I take this drug? If you have an allergy to bicalutamide or any part of this drug, if you are allergic to any drug like this one, any other drugs, food, or other substances, tell your doctor about the allergy and what signs he had, like rash, hives, itching, shortness of breath, wheezing, coughing, swelling of face, lips, tongue, or throat, or any other signs. If you are a woman, this drug is not approved for use in women. If you are a woman using this drug, talk with your doctor. If you are pregnant, plan on getting pregnant or breastfeeding. Because a lot of the things that can happen when taking this, because how it messes with like testosterone levels and stuff, not really recommended if you're pregnant. So, yeah. This drug may interact with other drugs or health problems. Tell your doctor and pharmacist about all of your drugs, prescription or over-the-counter, natural products, vitamins, and health problems. You must check to make sure that it is safe for you to take this drug with all of your drugs and health problems. Do not start, stop, or change the dose of any drug without checking with your doctor. What are some things I need to know or do while taking this drug? Tell all of your healthcare providers that you take this drug. This includes your doctors, nurse, pharmacists, and dentists. Avoid driving and doing other tasks or actions that call for you to be alert until you see how this drug affects you. This drug may raise the chance of high blood sugar, diabetes. Talk with your doctor. If you have high blood sugar, diabetes, talk with your doctor. Check your blood sugar as you have been told by your doctor. Have blood work checked as you have been told by your doctor. Talk with your doctor. Very bad bleeding has happened in people taking certain blood thinners like warfarin with this drug. If you are taking warfarin or other drugs like warfarin, talk with your doctor. You will need to have your blood work checked more closely while you're taking it with this drug. Get medical help right away if you have any unexplained bruising or bleeding. You may get sunburns more easily. Avoid sun lamps, and tanning beds. Use sunscreen and wear clothing and eyewear that protect you from the sun. This drug may affect being able to father a child. Talk with your doctor. That's because of how it blocks, binds around the testosterone, which can cause the sperm to reduce in the fluid and all that. So yeah, because that can reduce how much you end up producing. If you are a man and have sex with a female who could get pregnant, protect her from pregnancy while you take this drug. And for 130 days after your last dose, use birth control that you can trust, because this can affect the testosterone levels in unborn males and cause birth defects. If you are a man and your sex partner gets pregnant while you take this drug or within 130 days after your last dose, call your doctor right away. What are some side effects that I need to call my doctor about right away? It's like warning, caution, even though it may be rare. Some people may have bad and sometimes deadly side effects when taking a drug. Tell your doctor or get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. Signs of allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing, or talking, unusual hoarseness or swelling of the mouth, face, lips, tongue, or throat. Signs of high blood sugar like confusion, feeling sleepy, more thirst, more hungry, passing urine more often, flushing, fast breathing, or breath that smells like fruit. Signs of high blood pressure like a very bad headache or dizziness, passing out, or change in eyesight. Signs of infection like fever, chills, very bad or sore throat, ear or sinus pain, cough, or sputum or change in color of sputum, pain in passing urine, mouth sores, or wounds that will not heal, shortness of breath, a big weight gain, or swelling in the arms or legs, enlarged breasts, breast pain, not able to pass urine or change in how much urine is passed, chest pain or pressure, blood in the urine, muscle weakness, feel very tired or weak, very bad, sometimes deadly liver problems have happened with this drug. Call your doctor right away if you have signs of liver problems like dark urine, feeling tired, not hungry, upset stomach, or stomach pain, light colored stools, throwing up, or yellow skin or eyes. Very bad and sometimes deadly lung problems have happened with this drug. Call your doctor right away if you have lung or breathing problems like trouble breathing, shortness of breath, or a cough that is new or worse. Okay, what are some other side effects of this drug? All drugs may cause side effects. However, Many people have no side effects or only have minor side effects. Call your doctor or get medical help if any of these side effects or any other side effects bother you or do not go away. Hot flashes, upset stomach, diarrhea, constipation, not able to get or keep an erection, dizziness, feeling sleepy, feeling of warmth, sweating a lot, back, pelvis, or stomach pain, feeling tired or weak, headache, anxiety. These are not all of the side effects that may occur. If you have questions about side effects, call your doctor. Call your doctor for medical advice and side effects. You may report side effects to, if you can see this one right here, how is this drug best taken? Use this drug as ordered by your doctor. Read all information given to you. Follow all instructions closely. Take with or without food. Take this drug at the same time of day. To gain the most benefit, do not miss doses. Keep taking this drug as you have been told by your doctor or other healthcare provider, even if you feel well. What do I do if I miss a dose? Skip the missed dose and go back to your normal time. Do not take 2 doses at the same time or extra doses. How do I store or throw away this drug? Store at room temperature. Store in a dry place. Do not store in a bathroom. Because like in a bathroom, like in the shower, the humidity can destroy and ruin drugs. Things like that. Keep all drugs in a safe place. Keep all drugs out of reach of children and pets. Throw away unused or expired drugs. Do not flush down the toilet or pour down a drain unless you are told to do so. Check with your pharmacist if you have questions about the best way to throw out drugs. There may be drug take-back programs in your area. General drug facts. If your symptoms or health problems do not get better, or if they become worse, call your doctor. Do not share your drugs with others, and do not take anyone else's drugs. Keep a list of all your drugs, prescription, natural products, vitamins, over the counter with you. Give this list to your doctor. Talk with your doctor before starting any new drugs, including prescriptions, over-the-counter natural products, or vitamins. Some drugs may have another patient information leaflet. Check with your pharmacist if you have any questions about this drug. Please talk with your doctor, nurse, pharmacist, or other healthcare provider. If you think there has been an overdose, call your poison control center or get medical care right away. Be ready to tell or show what was taken, how much, and when it happened. Consumer information, use, and disclaimer. This information should not be used to decide whether or not to take this medicine or any other medicine. Only the healthcare provider has the knowledge and training to decide which medicines are right for a specific patient. This information does not endorse any medicine as safe, effective, or provide or treating any patient or health condition. This is only a brief summary of general information about this medicine. It does not include all information about the possible uses, directions, warnings, precautions, interactions, adverse effects, or risks that may apply to this medicine. This information is not specific medical advice and do not replace information you receive from the healthcare provider. You must talk with the healthcare provider for complete information about the risks and benefits of using this medicine. Okay, my experience with taking it, well, it's better for you than spironolactone, and it works more effective at a lower dose, so you're not having, like with spironolactone, taking 200 milligrams a day, spit like in the morning and evening. Well, this one, you can take like 50 and get the same benefits. And there's things that has happened while I was taking it, and things that happened when I went off of it. Because I was taking 50 milligrams a day for about a year. What happened was I had increased spontaneous orgasms, which wasn't really a fun thing. I can't say that will happen to anyone or not, but when I went off of the bicalutamide, my spontaneous orgasms dramatically dropped off every single month. And this is also coinciding with the estrogen injections and whatnot. So look out for that video of the estradiol injection. So I went off of bicalutamide, and then each month my spontaneous orgasms kept dropping off. It didn't completely go away, but it's dropped off significantly. And a big thing that's happened with it, it lowered my testosterone to the point where it was 3 below 0, pretty much zeroing out my testosterone. So I had to go off of it. And that was also coinciding with the estradiol injections and the micronized progesterone together was also lowering my testosterone enough. So I had to go off of bicalutamide. And my opinion, it's so much better than spironolactone. So I can't say it's right for you, but I highly recommend bicalutamide over spironolactone. Because one thing with spironolactone, it can atrophy your breasts out from fully growing to what they would have. Yeah. Pretty much cooks your breasts and would prevent your breasts from growing to where they would have otherwise gone to. And taking bicalutamide, it won't do that on HRT with all the changes. So that's pretty much my experience with it. It worked, yeah. When I first started taking it, it instantly started working instantly from the first dose. It's that effective. And no really side effects except increased spontaneous orgasms. And going off of it, the orgasms pretty much dropped off to almost nothing. So, yeah. And it actually helped overall with my health and all the issues with spironolactone I was having. I didn't have on bicalutamide. So this is all the information on bicalutamide and my experience taking it as a trans woman.